hear you.
Good evening, and thank you for joining us for our family webinar series, How to Help Your Students When They Are Sick and Away from Home. My name is Alyssa Mustard, and I'm a graduate student for Family and Transfer Engagement at Fort Hays State University. I will now introduce the presenters for this evening from Student Health and the Office of Student Affairs.
Hi, this is Chris Guest, and I am the Administrative Assistant to the Vice President for Student Affairs.
Hello, and this is Lynn Adams, and I am the Director of Student Health. So we'll get started here and talk about the services that are available. We got a shot of the front of the Student Health. Student Health is located on campus in the basement of the Memorial Union. We're open Monday through Friday, 8 to 4:30. Students can call to schedule an appointment, or we also have an email address, or they can drop in.
The Office of Student Affairs is located in the Sheridan Hall, room 208. Our office hours are 8 a.m. to 4:30 p.m. Our telephone number is 628-4277, and our website is fhsu.edu/studentaffairs. Dr. Joey Lynn is the Vice President for Student Affairs, and I am his administrative assistant. Dr. Lynn oversees the Student Health Center and is part of one of his duties, and we help students when they have problems with attending class, and we'll go over that a little bit later in our webinar.
The providers we have in the clinic, we have 3 in total. Dr. Dallas Richards is an internal medicine physician. He has been with the Student Health Center for a little over 25 years. Provides guidance and medical oversight for the services that we render there. Working with him are 2 nurse practitioners, Melanie Heimerman, who has been there now since May of 2012, and Melinda Wells, who has been there since 2009. I'm really proud of this group of providers. I think they have a genuine interest in students and certainly stretch to try to make sure that they provide the services that students need.
What we want to talk next about is the privacy that we have to work with when we're working with our students, because they are college students, they are legal. So we have 2 regulations that we use that protect their privacy. In the Student Health Center, we use FERPA, which is the Family Educational Rights and Privacy Act. And this is to release information other than directory information. Students must authorize access for non-directory information for third-party access. So for students who are wanting to have their parents or anyone else, guardians, to have access to be able to talk to campus officials, either in the Student Affairs Office, Residential Life, Student Fiscal Services, the Registrar's Office, Academic Advising, they would have to complete a student authorization for release of educational records, and that can be found on the Registrar's website under FERPA.
Then in addition to FERPA, there's also the HIPAA regulations, and most people now have become somewhat familiar with what HIPAA is, and it regulates the privacy of individual medical records. The reason we talk about this is that at many times parents will want information that has to do with academic records or a student's medical information. And when a student is 18 years of age or older, they have to consent to authorize access to information. And we provide a document at check-in, an electronic document in which every student who checks into the health center can indicate who they share their medical information with, and provide us the names, and even something as innocuous as asking what was a service for on a certain date. We would have to have permission from the person whose medical record is affected in order to release that information. And we're going to move from there about cover what the Student Health Center has available. Uh, we see it as really a mini medical clinic on campus. Um, and what we hope is that your student doesn't have to come to the Student Health Center. And when you communicate and talk with your student, it's much easier to stay healthy than it is to get better. And I think reminding people, even though this information is pretty simple, it's not easy to do. But adequate sleep, a good diet, adequate nutrition, exercise regularly, relaxing and stress management, maintaining your relationships, and a certain level of just hygiene will help keep students healthy when they're on campus. It is an institution. You have a lot of people here. Uh, simply keeping your hands clean and avoiding individuals who are coughing out in the air are just simple things that can help keep you healthy while you're here. But let's assume you don't stay healthy. Well, why would you want to come to Student Health Center? Well, we have discounted fees. We do have fees, but for students, they are certainly reduced. Um, we also, if a student is ill and presents themselves at the Student Health Center, we will triage them and get them in to be seen as soon as we can. And we also sell medications, not only over-the-counter medications, but we have prescription medications available at the Student Health Center. We can write those prescriptions right there and vend the medication right away. Oftentimes, those medications are less expensive depending on what kind of drug coverage you have on your insurance plan. But many of our medications are less than $10 for a course of antibiotics, for example. And in addition to that, we have a lot of free stuff. Although we don't try to equip the entire campus, but we have Band-Aids available and ice packs and sunscreen. And out in our lobby, there are Hall's cough drops if available. And certainly during flu season, we make masks available. So all that stuff is available at the Student Health Center just on coming in and requesting it. We provide preventive health services. Our two lady nurse practitioners really, I think, do an especially good job of providing women's health services, including PAPs. We also certainly will provide physicals for men and acute care, urgent work-ins. So somebody comes down with a cold or has a minor illness or injury, those can be worked in and presented when they come to the Student Health Center. Then in addition, students in some programs need to have a physical done. We can provide those physicals. Some students may have to have an employment physical, and that's available as well. We have a limited number of laboratory services on site. We also have access to Quest labs, and so we can draw specimens and send them out. And in fact, we do have students at times who need a regular laboratory test because they're seeing a physician in their hometown. And rather than have the student commute someplace else, they can come on campus. We can draw that blood and send that lab test order to the laboratory, and then forward those results to the student's treating physician if that is helpful. I'd mentioned medications earlier, and we also provide a host of vaccines. Anybody who has gone through vaccines recently know they are expensive. We have very small markup, just a few dollars on our vaccines. We're just trying to cover our shipping and handling fees for those, but we have hepatitis vaccines available, meningitis vaccine, Tdap, varicella, others. We also have flu vaccines available for this year, and those are free to all students. So all the student needs to do is present themselves to the Student Health Center, either schedule an appointment online or call and get into the nurse's schedule, and they will have a free flu shot. For those students that need it, we can also rent crutches. We have a nebulizer for students who may have asthmatic problems, and all that's available at the Student Health Center. And finally, when I talk about services, we do offer coordination with the Kelly Health Center. The Kelly Center provides mental health counseling and mental health services here on campus. The Kelly Center's services are free, and when a student presents at Student Health Center and may have symptoms that could be alleviated by counselors at the Student Health Center, we can make those referrals. Vice versa, when a student has a medical issue and presents at the Kelly Center and they need to be seen medically, maybe for continuing medication or prescription of certain medications, we can assist with that as well. To make an appointment, it's pretty simple. Certainly you can call, you can go online, send an email, but we also have a student health portal on the FHSU website. The easiest way to get there is go to the landing page of Fort Hays State University website, which is fhsu.edu, and in the search term, type in student health. That will take you to this page, and clicking on that icon there with the student health portal brings up this page, and students can actually schedule their own appointment online and work themselves right in the schedule, and can avoid phone conversation if they choose to do so. In addition to appointments, they can also view their immunization information, insurance information. We'll have forms out there that can be completed. We will send students secure messages at times in order to notify them of lab results or when we need to get a hold of them, and they can also look at their balances. When they have an appointment, we want the student to come in, and they can bring their student ID if they need that, but should also bring their insurance card. We will submit claims to insurance on behalf of the student, and while it's not a requirement to have payment at the Student Health Center, it can be that when we vend drugs for $5, we usually collect the fee for the drugs at the time of service, and we'll certainly bill for any of the professional services on an insurance claim form. Now, as I said, payment is not required. We file health insurance claims. Once we do receive a statement from the health insurance, we will post those payments to the student's account, and then we will send a statement. If we do not receive payment, we will send a second statement, and then finally a letter. And we do expect payment. We will certainly work with students. We have an option for hardship, and we have used that for students who really have no means and have certain health problems, and we're glad to do that. If, however, a balance remains unpaid, we can put a hold on a student's future enrollment. I wanted to cover quickly here the things that it's very helpful for a student to have when they arrive to college and set up their household. A thermometer is very handy, and there's reasons for that. Taking a temperature and figuring out how sick you are is pretty important. Simple pain medication, whether that be aspirin or an ibuprofen or some other, whatever name brand a person uses, just have that available. A cough medicine. I think between a pain and a cough medicine, that's pretty simple. Most people know which medications provide that. But an antihistamine is also very helpful as well. When a student is having allergy symptoms and that sort of thing, to be able to manage those medications with over-the-counter, or those symptoms with over-the-counter medications can save a trip to a doctor, save a trip to the health center, and certainly make a person more comfortable until they could make those arrangements. Even having bandages available makes sense, along with some kind of ointment, because you never know when you're going to get cut and need to be able to clean a wound, dress it, and put it. And many of these things do not require a visit to the health center. An individual can take care of it themselves. And I'm making an assumption that often students, their first provider of health services is their parent. And they make a phone call and describe what they have. And then if they have these items available in their own personal medicine chest, they can save themselves a little bit of trouble. Sunscreen, some kind of anti-itch cream is very helpful, a hand sanitizer, and tweezers. It was a surprise to me at how many students will present at the student health center simply to have a thorn or a small sliver removed, when if they had their own tweezers, they could certainly take care of that themselves. When you get that phone call from your student at some point and trying to make a decision on what to do next, we looked at some of our more common diagnoses, and I talked with the nurses about, well, when do you make that decision that, well, I can stay home and treat this myself, or maybe I should contact student health center? When you're talking about colds and flu symptoms, the majority of colds and flus in particular, are caused by a virus. And when you have a virus, an antibiotic does you no good. You have to just wait out the symptoms, and you want to treat the symptoms as well as you can. But when your symptoms last longer than 7 days, if you have an earache associated with a cold, if you have painful burning swallowing or white patches on your throat, which may indicate a bacterial infection, if you have a cough that just hangs on and hangs on, or if your fever is higher than 105 degrees, that's the time to call your provider, call the student health center, and come in and be seen. And at that point, you may need an antibiotic. Rashes, cuts, skin problems. We do see a lot of minor rashes. A lot of them will resolve upon their own with over-the-counter medication. But you know, when it is painful, hurting, when it is swelling up and blistering, this happens to be a poison ivy. Or if you have a fever accompanying the rash, that's really the time to see a provider. To call, make an appointment, get in, get it looked at. Might need some sort of steroid prescription or some other medication that could be advised. And then we do see certainly cuts and scrapes. Again, many of those can be managed at home if you have the medications to do it with. But when you get a cut across a joint or a gaping wound, or if you have a cut on a face or something, worried about cosmetics, then you might want to consider seeing a provider and getting stitches. Now, in the Student Health Center, we do not stitch wounds, so a gaping wound should probably go directly to the emergency room. What we can do, though, is small cuts, and it's hard to define what a small cut is, but you know, something that can be pulled together with an adhesive bandage. We have those available, and many wounds can be treated that way. Vomiting, diarrhea, you know, moderate to severe abdominal pain are an indication you need to see a provider. Dehydration, where you have dry mouth, confusion, and you haven't been able to urinate for a long period of time. Unusual color to vomit or stool. And if you have more than 8 to 10 stool and or vomiting episodes in a day's time, and that's time to see a provider, because it certainly could lead to dehydration, and you probably need to be seen by a professional at that point. There are times when it wouldn't do you any good to come to the Student Health Center, and many students come to the university and have already had a history of treatment for some kind of chronic disease or some kind of anomaly that they've been seeing a professional. So if you have been seeing a cardiologist in your hometown and you want to establish care in Hayes at Fort Hays State, it'd be best to contact a cardiologist here and establish that care. That way your records can be transferred over and an orderly transition made for that handoff of care. So I think the rule is, if you've been seeing a specialist in your hometown, you probably will continue to need a specialist when you go off to college, unless you're not so far away that you can make those trips fairly readily. We can always help assist with making those connections here in town with information and contact numbers on providers who will be taking new patients and make the appointment connection here in the community. I'd say this too about head injuries. Anytime there's a head injury with a loss of consciousness, that is an indication for a CT done, and that should go direct to the ER. Head injury with vomiting afterwards also should go to the emergency room. Those are that is one injury that should bypass student health center. Signs and symptoms of stroke and or heart attack. Luckily, in this population, we don't see that very often, but surge speech, severe headache along with it are an indication of a stroke, and that should go right to the ER, as well as chest pain that is radiating down to the arms from the central area there. That's something that shouldn't be messed around with. That should go right to the ER. So I'm going to finish there. I'm going to transition over to Chris at this point, and she's going to talk a little bit about the policies and procedures here at the university when your students are unable to attend class. And there you go, Chris.
So when a student is ill or hospitalized or cannot attend class, the Student Affairs Office, and a lot of terms for students coming into college, we're kind of like the principal's office where students can call into our office. Our office works together with the Student Health Center. If students are seen at the Student Health Center by a provider and the provider has recommended and instructed the student not to attend class, the Student Health Center will call the Student Affairs Office and let us know that they're telling us to let the professors know that they cannot attend class. So we will send out a professor notification letting them know that the Student Health Center has recommended them not to attend class. If a student doesn't go to Student Health Center and knows that they can't attend class, our office will send a professor notification for up to 3 days without documentation. So if a student is ill at their apartment or in the residence halls and they know they can't attend class, they can call our office and we'll do a notification to the professors. If they're hospitalized, or even if a family member is hospitalized, or a death in the family, or a family emergency that takes them away from classes, our office does not send out professor notifications if a student chooses, if they're called into work or they're leaving for the weekend early because they're choosing to leave. Our office does not do that, but we will do professor notifications. In most instances, professors will put in their course syllabuses that students are to call the Student Affairs Office about class absences. Our notification does not excuse a student from their classes. It's just a notification letting the professors know. How a professor deals with a student's absence is completely up to each and individual professor. They have that luxury of doing that. So when we ask for documentation of a class absence for like hospitalizations, or if they're going to be gone longer than that, the documentation comes to the Student Affairs Office. We don't share that documentation with professors. We just let them know that it is on file and that we are seeing the documentation. We also send out for other things, for other instances, and it's all case-by-case situations. Sometimes students travel home for weekends and have car problems. Our office can help with that. Or, if they're traveling weather-related instances, we do not send out, once we get into the cold weather systems coming in over the weekends, but they've traveled home and like icy roads and they can't get back, we usually have the students contact their professors. We do tell the students that if they are having problems with their professors and when they get back and trying to make up coursework, if they have any other problems, to get back with us, and we'll see what we can do for them. So besides the professor notification from our office, for the unforeseen problems for students, and this is the worst case scenario, when students, our office does help students through the medical withdrawal process. This is when an extenuating circumstance has happened either for the student, for themselves, or for their family, and it's usually for medical or psychological reasons. To request a medical withdrawal, there is a process. The student needs to provide a written request along with supporting medical documentation that must be submitted to the Vice President for Student Affairs. And then the Vice President then forwards that appeal on to the Medical Appeals Committee, who then reviews that. And basically what they're looking at is the last date of participation, attendance, and class, when the medical situation happened. And they take that all into consideration. They can award a tuition refund, but then we also have to look at the last date of attendance when a student is going to class, and if the student is a financial aid recipient. Because if they receive financial aid, there's a Title IV requirement that we have with the federal government that requires us to repay financial aid. So that's something that a student needs to be aware of if they're doing a complete medical withdrawal. That's when they're withdrawing from all of their courses. We have to look at a repayment. So, and that all would have to be repaid before a student could ever return to the university. And if it's not repaid, a hold goes out onto their account. And this is for worst case scenarios. And we try to work with students on that one on a one-on-one basis and counsel them through that.
So at that, we've reached the end of the program. In summary, we want parents to know that we have a support structure here for their students in the medical clinic, and that when a student has encounters certain situations where they're going to have to be gone or be away, there's some procedures that need to be followed and people to be contacted. That's our information. If you ever want to get a hold of us and have further questions, we'll certainly take any now if there are those. But otherwise, I'll turn it over to Alyssa.
If you would like to ask a question, there should be a box where you can type in a question. And if there is, we'll answer those before we end. Okay, with that, we are going to close our webinar tonight. I will note that we have a webinar planned for February of 2016, so keep an eye out for those upcoming emails and any emails that you would get for other events for family events. We thank you for attending, and we hope you have a great evening. Thank you.